Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists nurse practitioners with employment contract and independent contractor agreement issues. Today, I'm going to talk about productivity and quality incentives for nurse practitioners. So, when you are reviewing your contract, I'd say the vast majority of nurse practitioners are just compensated via straight base salary. But there are opportunities many times for you to be bonused based upon your productivity. And then also, if you're working for a hospital or healthcare network, sometimes they'll also offer bonuses for quality. And we'll kind of go over both of those. So let's start with productivity first. Now, there are many ways to bonus a nurse practitioner based upon their productivity. And it kind of depends upon the setting where you are. So first, if you're in private practice working for a physician's office, or if you're in a state where you're autonomous and working for, an NP-owned practice, normally they're going to use net collections as the metric to define what your bonus would be. And so that means you would get a percentage based upon what the practice receives, via your personally performed services. There's many ways you could do it. They could be monthly, quarterly, annually. And so how a normal practice would do it, they would say, all right, we will, at the end, let's just take a quarter. We'll take all of the money that we've paid out to you via salary, and that will be, subtracted from your collections. And then whatever is left over, you will get a percentage of that. So, I would say in this case, somewhere between 10 to 20%. In a bonus scenario would make sense. If you're being paid purely on collections and nothing else, then it'll be somewhere between 30 to 40%. So that's an easy way of doing it for private practice. Some practices I've seen will do it by encounters. They'll have, if you're an FNP and you're working primary care, and they may say, all right, you need to see an average of 20 patients a day or 25 patients a day, and any encounter over that amount per day, you'll receive X amount of dollars, or per week or per quarter, something like that. That'd be another way of doing it. Now, if you're employed by a hospital or a healthcare network, they're not going to do encounters. They're not going to do collections. They're usually going to do an RVU. And an RVU it's a relative value unit. It's basically a unit of measure for the acuity of encounters. Each year, the Center for Medicare Services releases a list. And so every encounter or CPT code that an NP has will have an RVU value associated with it. And so you would essentially multiply that RVU value times a monetary value, usually somewhere between, $15 to $40 for an NP. And so what they would usually do is they'd have a target RVU value, and this generally quarterly would be the lowest amount they would go, and they'd say, all right, we want you to produce 1,000 RVUs a quarter. And then every RVU that you produce above that, we will simply multiply times whatever the compensation factor is, and that's your productivity bonus. So those are kind of the most common ways of bonusing an NP. Now, as far as a quality incentive, as I said before, this generally is only if you work in a hospital or healthcare network. You will never, I'm sure they're out there, but as someone who's been doing this for 2 decades, I have never seen an individual practice bonus an NP on quality measures. It's almost always hospital or healthcare, and it can be based on a number of factors: patient satisfaction, getting your charting done in time, going to your departmental meetings, 100 different ways they could do it. Now, in that scenario, normally it would just be a one-time amount at the end of the year. They would take all the different factors, determine what your percentage of meeting those factors would be. They'd have a maximum amount, and they just multiply the maximum amount to however, whatever you met. So let's just say it was 90%. And you had a $10,000 potential quality bonus, then you get $9,000 at the end of the year. So these things are negotiable. I think a smart practice would incentivize any provider to be compensated for working harder, being more efficient, seeing more patients, bringing in more revenue. It just makes sense. It's human nature that you'll work a little bit harder when you have the opportunity to make a little bit more. So Maybe you're looking at a job where they don't offer anything. You certainly can offer and say, look, I think it's fair that I be bonused if I do reach certain metrics, and then that's something you can negotiate with the employer, and it just makes sense. All right, if you have any questions about your employment agreement or independent contractor agreement, feel free to reach out to me. All of our information is listed below in the description, and I appreciate you watching the video. All right, thanks. Take care.